Hello friends, how are you? For today's video, I will share to you my chosen disease caused by Helminth. Lymphatic filariasis, commonly known as elephantiasis, is a neglected tropical disease. Infection occurs when filarial parasites are transmitted to humans through mosquitoes. Infection is usually acquired in childhood, causing hidden damage to the lymphatic system. Lymphatic filariasis impairs the lymphatic system and can lead to the abnormal enlargement of the body parts, causing pain, severe disability, and social stigma. The painful and profoundly disfiguring visible manifestations of the disease, lymphedema, elephantiasis, and scrotal swelling occur in life and can lead to permanent disability. These patients are not only physically disabled but suffer mental, social, and financial losses, contributing to stigma and poverty. In 2020, 863 million people in the 50 countries were living in the areas that require preventive chemotherapy to stop the spread of infection. The global basement estimate of people affected by lymphatic filariasis was 25 million men with hydrocele and over 15 million people with lymphedema. At least 36 million people remain with these chronic disease manifestations. Eliminating lymphatic filariasis can prevent unnecessary suffering and contribute to the reduction of poverty. Early symptoms of lymphatic filariasis consist of intermittent fever and enlarged, tender lymph nodes. The inguinal lymph nodes are very often involved. The lymphatic vessels that drain into the lymph nodes and that harbor the developing and adult worms also become inflamed and painful. Filariae are nematodes or roundworms. They are vectored by arthropods, mature and mate in specific host tissues, and produce microfilariae. Lymphatic filariasis has host a non-filarial worms have humans as a definitive host. Its vector, a wide range of mosquitoes can transmit the parasite depending on the geographic area. Its pathogenesis, filariasis infection, occurs when a larva carrying mosquito bites an individual, introducing this larvae into the skin. Let's talk about the transmission, symptoms, prevention, and treatment of the disease. Filarial worms infections are transmitted as follows. An infected fly, such as horsefly or deerfly, or mosquito bites a person and deposits larvae of the worm in the skin. The larvae mature into adult worms under the skin or in the lymph tissues. Symptoms may include itchy skin, pruritus, abdominal pain, chest pain, muscle pain, and areas of swelling under the skin. The best way to prevent filariasis is to avoid mosquito bites, particularly in tropical areas. The main goal of treatment of an infected person is to kill the adult worm. Diethylcarbamazine citrate or DAC, which is both microfilaricidal and active against the adult worm. It is a drug of choice for lymphatic filariasis. Filarial infections are a classic example of chronic infections in which complete elimination of all parasites is rarely achieved, presumably since sterilizing immunity might necessitate host deleterious immune responses. Lymphatic filarial worms have several immunologic effects on host immune systems, which promote chronic infection and curtail anti-inflammatory responses. So, to avoid this kind of disease, we need to refrain from going outdoors at dusk or dawn when the mosquitoes that transmit filariasis are highly active. Cover yourself with long-sleeve shirts and trousers. Refrain Refrain from sporting strong perfume or cologne which can draw the attention of mosquitoes. Sleep inside an insecticide-treated or plain mosquito net.